Have you ever felt your heart beating for no reason while sitting comfortably in your favorite chair? Perhaps you stood up too quickly, causing the room to spin for too long. These may appear to be trivial issues, but your heart occasionally whispers for help. Heart failure does not usually manifest as a major heart attack or a trip to the ER. In reality, it typically starts quietly, with little signals that are easy to miss. And that is precisely what this video is about. Recognizing those early, silent indications before they become serious. We're not going to talk about medical jargon or terrible numbers today, just you and me. Having a calm, honest conversation about what your body might be telling you. Because disregarding the small things in your heart might have serious implications. If you're ready to pay close attention to what your heart is saying, leave a remark 1. If not, simply hit 0. Don't forget to subscribe to Senior Lifestyle. Now, let's take a closer look at the first symptom, which sometimes goes unnoticed. When your heart grows tired, it does not necessarily cry out in anguish. Sometimes it just accelerates, like a worker attempting to make up for missed time. That is why a rapid resting heart rate might be one of the early symptoms of heart failure. Normally, when you sit or relax, your heart should beat softly, 60 to 100 times per minute. However, when the heart is weak, it has to work harder to circulate blood throughout the body, even if you are doing nothing at all. You may feel your heart hammering in your chest, fluttering, or racing for no apparent cause. Some people describe it as a sudden thump, thump that takes them by surprise, even when watching TV or reading. This is not a passing emotion. Over time, this increased effort wears out the heart even more. According to the American Heart Association, a continuously high resting heart rate has been related to an earlier onset of heart failure and an increased risk of complications. If something sounds familiar, don't dismiss it. Keep a simple record of your heart rate, especially when you are not exercising. You can use a simple wrist monitor, or many smartphones now include this feature. If your resting rate consistently exceeds 100 beats per minute, consult your doctor. It's a tiny deed that could have a major impact. Let's move on to the next early indicator, which many people misinterpret with aging or simply being fatigued. Have you ever entered a room and forgotten why you're there? Have you ever struggled to follow a conversation or stay focused when reading a paper? Many people believe it's just age, but your heart could be transmitting signals to your brain. When the heart pumps poorly, less oxygen-rich blood reaches the brain, which requires a consistent supply to remain sharp. Without it, you can feel cloudy, forgetful, or lose track of your ideas. It's more than just being absent-minded. This is a warning indication. According to research published in the Journal of the American College of Cardiology, even early heart failure is associated with cognitive loss. Everyday lapses, such as misplacing keys, losing attention, or feeling mentally drained, can indicate a decrease in brain blood flow. If this sounds similar, note when it occurs. Following exercise, ascending stairs, or late in the day. Patterns help doctors see the connection. This is not to scare you, but to discover problems early, when you can still safeguard your memory and heart. Let's take a look at another danger signal that frequently appears in your legs toward the end of the day. Do you ever find that by nightfall, your socks have left deep impressions on your ankles? Perhaps your shoes feel tighter, even though they fit well in the morning. Swelling in the feet, ankles, or lower legs is another early symptom that your heart is failing. When the heart fails to pump effectively, blood accumulates in the veins, pushing fluid into the tissues. That's why swelling develops in both legs and worsens during the day. It is not just tired feet. It is an indication of impaired circulation. Doctors refer to this as peripheral edema, which is a common indicator of heart failure. According to the National Cardiac, Lung and Blood Institute, Fluid buildup in the lower body is a common indicator of cardiac strain. A easy home test. Press your thumb against your shin. If a dent remains, consult your doctor. New or increasing swelling, particularly if associated with weight gain or shortness of breath, should not be disregarded. Your legs may be telling you what's going on in your chest. Listening early can help alleviate the strain on your heart. Next, we'll look at a warning sign that can cause dizziness or lightheadedness. Do you frequently get up and feel the world tilt for a few seconds? Perhaps you've nearly collapsed while doing something easy. These dizzy spells are not merely a result of aging. They may be one of the body's ways of indicating that the heart isn't supplying enough blood to the brain. When circulation is poor, even minor motions, such as rising from a chair or walking across the room, can result in a significant decline in blood flow. That's why many people with early heart failure experience dizziness, lightheadedness, or near blackouts. According to a study published in the European Heart Journal, lower blood supply to the brain is closely associated with these symptoms. It is not only uncomfortable, but also potentially dangerous. For older persons, fainting or losing balance increases the likelihood of a serious fall. If this happens more than once, do not disregard it. Write down when it happened and what you were doing. Does it occur after rising up quickly? After light exercise? These details are important. The next time you feel dizzy, sit down immediately, breathe slowly, and allow your body recover. But most essential, discuss it with your doctor. Paying attention to these indications can help you safeguard your heart and yourself. Now, let's speak about an indicator that typically keeps people up at night. Having to go to the toilet repeatedly. Do you find yourself waking up numerous times per night to use the restroom? Frequent midnight urination, also known as nocturia, may appear to be a typical part of aging, but it might be an early warning sign that your heart is under stress. When you lie down, the fluid stored in your legs returns to your bloodstream. The kidneys filter more, resulting in frequent toilet excursions. Waking up 3 or 4 times per night is more than just a sign of inadequate sleep. It frequently represents fluid overload caused by early heart failure. According to the Cleveland Clinic, this symptom may develop before others and is more than just bothersome. Broken sleep depletes vitality, decreases immunity, and puts additional strain on the heart. If this happens frequently, keep track of how many times you wake up and whether your legs swell in the evening. Simple steps, such as elevating your feet during the day, can help prevent buildup. But if it persists, consult your doctor. It could be larger than a tiny bladder. Your nights should be restful and uninterrupted. Paying attention to this signal may provide the rest your heart requires. Now, let's go on to another caution. When your hands and feet get particularly cold, even in warm weather, have you noticed that your hands and feet stay cold even when the environment is warm? This isn't necessarily due to the weather or reduced circulation from aging. It can actually indicate that your heart is working harder than it should. When the heart weakens, it must make decisions. The body prioritizes blood flow to the brain and essential organs, leaving less for the arms, legs, and skin. That is why some persons with early heart failure report feeling chilly or even numb in their fingers and toes. Sometimes the pulse in the wrist or ankle appears faint because blood isn't reaching it as well. According to a study published in the American Journal of Cardiology, people with early cardiac disease often have lower peripheral blood flow. It's the body's method of safeguarding what's most vital, but it makes the rest of you feel ignored. If this occurs frequently, pay attention. Try gently warming your hands and feet, but keep track of how chilly they remain in comparison to others around you. That contrast is a clue you should share with your doctor. Cold hands and feet may appear little, but they can be early indicators of a larger disease inside. Now, let's talk about something that happens when you try to be active, feeling short of breath even with minimal effort. Do you become winded just by climbing a few stairs or walking to the mailbox? Shortness of breath during light activity is one of the most prominent early warning indicators of heart failure. When the heart is unable to pump strongly, blood accumulates in the lungs, making it difficult for oxygen to move where it is needed. That is why even minor efforts can leave you feeling fatigued, as if you had just run a mile. This is not about being out of shape. According to research published in the Journal of the American Medical Association, dyspnea with light exercise might emerge years before a formal diagnosis of heart failure. Many people reject it, supposing they are simply getting older or slowing down, but it is actually the body issuing a warning. If this seems similar, pay attention to the patterns. Do you notice it while carrying groceries, gardening, or simply walking and talking? Keeping track allows your doctor to see the wider picture. Pacing yourself is a helpful approach. Take breaks, move carefully, and avoid pushing through extreme exhaustion. But, most importantly, do not disregard it. What seems like a little inconvenience today could be an indication that your heart requires assistance. Next, we'll look at a warning that appears when you lie down at night: the inability to breathe comfortably without additional cushions. Have you ever tried resting flat in bed and suddenly felt as if you couldn't breathe? Many persons with early heart failure find that they need extra pillows just to sleep comfortably. Some people end up sleeping upright in a chair because it's the only way they can breathe without difficulty. This isn't just about snoring or aging. This is a condition known as orthopnea. This is what's happening. When you lie down, fluid in your body rises higher, increasing pressure on your lungs. A weakened heart cannot take the additional burden, resulting in a heavy, suffocating feeling. According to studies published in the New England Journal of Medicine, orthopnea is a powerful predictor of heart failure development, often occurring before other characteristic symptoms. You may test this by keeping track of how many pillows you use while sleeping. If you consistently need 2 or 3, or if you only get relief when you sit up, talk to your doctor about it. Now, let's look at another warning indicator that can appear quickly: abrupt weight increase caused by concealed fluid buildup rather than food consumption. Have you ever stepped on the scale and realized you'd gained 2 or 3 pounds nearly overnight, despite not changing your eating habits? Rapid weight gain like this is frequently caused by fluid accumulation in the body, a classic early symptom of heart failure. When the heart isn't pumping properly, the kidneys hold on to salt and water, causing fluid retention. This extra fluid does more than merely increase the numbers on the scale. It might create swelling in your abdomen and ankles, making breathing more difficult. According to the American Heart Association, a sudden weight increase of more than 2 to 3 pounds in a single day, or 5 pounds in a week, is a clear indication that your heart requires treatment. That is why many doctors urge that you weigh yourself at the same time every morning. It's one of the simplest ways to detect changes before they become problematic. If your weight suddenly increases, don't disregard it. Contact your healthcare professional. Keeping a modest log of your daily weight can make a significant effect. A few pounds might not seem like much. However, when it comes to heart health, those pounds could be your body's way of signaling for assistance. Next, let's look at a common stomach symptom: feeling full, bloated, or losing your appetite. Have you ever felt full after only a few bites, or experienced bloating that did not appear to be related to what you ate? This painful heaviness in the abdomen may be another early indicator of heart failure. Ascites is a disorder in which fluid accumulates in the belly due to weakened cardiac function. It increases pressure on your stomach and liver, leaving you feeling full even if you haven't eaten much. People frequently believe they have indigestion or a slow stomach, while in reality, the heart is trying to keep blood flowing smoothly. The National Heart, Lung, and Blood Institute reports that abdomen bloating and appetite loss are prevalent in people with early heart failure. If you're seeing this, take attention to whether your waistband feels tighter at night or if you lose interest in meals you used to like. A diet and symptom diary can help your doctor identify patterns. This isn't all about comfort. If your body cannot absorb enough nourishment, it weakens even further. Protecting your hunger implies preserving your strength. Let's take a look at another missed signal. Developing a persistent cough or wheeze, particularly while lying down. Have you ever gone to bed and been kept awake by a persistent cough? Many persons with early heart failure experience a dry, persistent cough that worsens when lying flat. Some people describe a wheezing sound, similar to asthma, but inhalers do not provide relief. When the heart does not pump strongly, fluid backs up into the lungs. The additional fluid irritates the airways, making breathing harder at night. According to research published in the American Journal of Respiratory and Critical Care Medicine, this type of midnight cough is a common warning sign of fluid overload that can lead to heart problems. Keep track of when coughing persists after regular cold or allergy medicines. Does it get worse if you lie down? Do you sleep better when propped up? These details are important. Sleeping with your head slightly elevated is a beneficial approach, but keep in mind that this simply relieves the symptoms. The true solution is to have your heart evaluated. Next, let's discuss another uncommon symptom. It's difficult to breathe comfortably when just bending forward, such as when tying your shoes. Have you ever stooped down to tie your shoes or pick something up, only to be out of breath in seconds? This strange symptom has a name: bendopnea. It is not about being out of shape. When you lean forward, it is a clear indication that your heart is having difficulty dealing with pressure fluctuations. When you bend, blood moves to your chest. In a healthy heart, this is not a concern. However, in the case of heart failure, the increased pressure makes it more difficult for blood to circulate into the lungs, resulting in sudden breathlessness. A research published in the Journal of the American College of Cardiology discovered that many individuals with heart failure experienced signs of bendopnea within 30 seconds of leaning forward. If this happens to you, take note. It may appear while tying shoes, gardening, or reaching into a low cupboard. Keep track of how quickly it happens and how long it takes to relax once you sit up. It may appear to be a little inconvenience, but it is actually a strong early indication that your heart is under stress. Now, let's get to one of the most common and exhausting warnings: persistent exhaustion that lasts regardless of how much rest you get. Do you always feel exhausted, even after a full night's sleep? Many persons with early heart failure have severe weariness that may not subside with rest. It is not simply about becoming older. The body is indicating that the heart is not pumping enough oxygen-rich blood to supply your muscles and organs. This persistent lack of energy complicates routine work. Simple tasks like folding clothes, lugging groceries, and even taking a shower might leave you exhausted. According to studies published in the Circulation Journal, poor exercise tolerance and chronic fatigue are among the first and most severe symptoms of heart failure. Unlike normal sleepiness, this exhaustion lasts. You may realize that you cannot walk as far as you used to, or that you require more breaks during the day. It frequently creeps up slowly, making it easier to ignore until it becomes overwhelming. If you are feeling this, pay attention to your body. Keep track of how frequently you feel tired out and what activities cause it. Share your notes with your doctor. They can reveal significant trends. Your strength and energy are essential for independence, and detecting these changes early can make a significant impact. So you've seen how heart failure frequently begins with minor, quiet symptoms: a racing pulse, swelling ankles, sleepless nights, or simply feeling more weary than normal. These signs may be simple to ignore, yet they are your body's way of signaling for attention. The good news is that catching them early might mean all the difference. Many people can still live full, independent lives with the proper care, lifestyle changes, and support. Your heart is worth listening to. It has carried you through every moment of your life, and it deserves to be treated well in return. If this video spoke to you, please share it with a friend so that we can raise awareness together. Don't forget to subscribe to Senior Lifestyle, where we'll keep providing straightforward, compassionate advice for a better tomorrow.